Do you find yourself living with dry, itchy, flaky, and sensitive skin and are frustrated with the repeated flare-ups as well as being unable to manage the condition well? If you are actually suffering from such condition as this, don't forget to follow and listen through to our entire video to find out more about the types of eczema, the causes of eczema, and how best to manage that. If you're looking for more interesting dermatological content, don't forget to follow our channel on YouTube. Eczema is usually a chronic inflammatory skin disorder that is characterized by red, dry, flaky, and itchy skin. This can happen over wide areas of the body, from the scalp, the facial areas, as well as the trunk and limbs. I like to think about eczema in two main or broad categories. I like to classify eczema types either into endogenous subtypes or the exogenous forms. The most classically known example of an endogenous eczema is atopic dermatitis. So atopic dermatitis typically onsets in young children or infants and sometimes progresses on into adulthood. Now, this is a form of genetic hypersensitivity and reactivity to the environment. It can also involve airway allergies such as allergic rhinitis and asthma as part of a triad. Under the exogenous category of eczema, a well-known example would be that of contact dermatitis. For example, if you're allergic to certain contactants like hair dye or fragrance or even nickel, for example, simple avoidance of that trigger can minimize the reoccurrence of such rashes. So what are the various morphological subtypes of eczema? So other than categorizing eczema into whether it's endogenous or exogenous, we can look at the characteristics or the appearance of various forms of eczema. I'd like to give you an example of atopic dermatitis once again. So in AD, in young infants, typically it presents over the cheeks or facial locations. In young children, usually over the flexural aspects of your arms and your legs. And in adulthood, just the trunk and limbs involvement as well. We can also look at discoid eczema, which is a different variant or subtype. Now in discoid eczema, this is frequently misdiagnosed or looked at as a form of fungal infection because it initially presents as round, annular, circular patches. Discoid eczema typically happens over the limbs and can also be whippy and oozy with a barrier dysfunction. Another type of eczema can localize to the hands and feet, what we know as dyshydrotic eczema, and typically occurs over areas where there's sweatiness over the palms and soles as well. Some patients may also have contact allergies as mentioned, and in contact eczema, it will typically localize to the area of application. For example, if you're allergic to a plaster or adhesive, for example, it might take the shape of your plaster that you apply to your skin. If you're allergic to maybe a hand wash or sanitizer, it could then co-localize to your hands predominantly. Now, although we have various clinical morphologies for eczema, frequently this can all coexist in the same single patient. For example, a patient with atopic dermatitis may start off having flexural fold involvement, but may also downstream develop patches of discoid eczema at the same time. And these are all variants of the clinical presentation of eczema, but can also coexist in one patient. There are a whole host of factors that can trigger or lead to eczema, and they all are part of a complex interplay or interaction. Genetics for eczema are not single gene by nature, but usually multifactorial. So if you are actually susceptible to eczema, it can run in your family. For example, you may then start off having atopic dermatitis at a young age. However, there's a certain percentage of patients that might also have a food trigger as well. So food allergens can also be a known trigger for the aggravation of eczema. For example, nut allergies or even seafood allergies. There are also patients who are basically genetically predisposed to having very dry skin type. For example, ichthyosis vulgaris is a dry skin condition where there's dry, flaky or fish-like scales over the extensors of the limbs, and this can also coexist with a patient with inherent immune dysfunction. As a result, dry skin type typically has a poor barrier function, and this can allow environmental pollutants and bacteria to enter the skin and cause disruption. Other factors can also include an interplay with the environment as well. So if the weather climate is not suitable for certain skin types, for example, if it's very dry, it may also predispose to eczema flaring up, or if it's very humid, it can also give rise to an aggravation of eczema. Other factors also include environmental allergens, for example, such as grass, certain pollen, and even dust mites. And avoidance of these environmental triggers can also minimize the flare-ups of eczema. Eczema typically presents with red, dry, flaky, and typically itchy skin. So eczema tends to plague sufferers with intense itch, and sometimes this may be the predominant symptom. Eczema also sometimes can be weepy at the same time, especially in discoid eczema where they present with very red, circular and oozy patches. Other symptoms of eczema can also include sometimes a warm sensation or burning sensation because of the barrier dysfunction, and even application of simple topicals like moisturizers can give rise to a stinging sensation. Eczema is typically diagnosed usually by visiting a healthcare professional such as your general practitioner, or in more severe cases and more uncertain cases, a dermatologist. Sometimes a skin biopsy might be necessary to confirm this diagnosis or to exclude other associated conditions. This is typically if the rash doesn't fit the classic morphology of typical eczema and your practitioner suggests or suspects something different. For example, mycosis fungoides is a rare cutaneous T-cell lymphoma that can occur with red, flaky patches affecting sometimes the trunk down to the buttocks of the body. So if your eczema isn't responding as planned, your practitioner might then suggest a skin biopsy to rule out other possible causes of red, flaky, itchy skin. Other things that might be also tested for include looking for certain allergies or allergens. This can be done with a skin prick test or even with a blood test called RAS allergy testing to look for certain food triggers as well as environmental triggers. We might sometimes also do other blood tests to look for certain things like your total IgE count to see how allergenic you are at that moment, as well as the full blood count. If certain medications are going to be deployed, such as certain immunosuppressive medications or even new class biologic medications or JAK inhibitors, your practitioner might also do a baseline workup to look for any underlying immune suppression before starting these medications. If you're uncertain about how to manage your eczema or even uncertain about your firm diagnosis and how best to manage your condition, don't forget to visit a healthcare professional like a dermatologist to get it checked as well as better managed. In our next eczema educational video, we will touch about the prevention and management of eczema. If you like our content, don't forget to follow us on our YouTube channel and hit the subscribe button.